Recovery after a full or extended neck lift involves the following. So most importantly, there's going to be a drain that passes from one side to the other. Empty that, I have a video about how to manage the drains in another video. We will take that out after 1 to 2 days. I'm gonna take down your dressings after 1 to 2 days as well. And at that point, I want you to wear nothing for a week. I may put you in a jaw bra neck strap and some foam to put pressure upward, but I won't do that for at least a week because the skin's a little bit fragile for that first week, and the risks of damaging the skin from that compression garment are worse than the benefits that it provides. So after neck lift, you're gonna go home with the drain. We'll take that out the next day or two. You'll go home with the dressing. We'll also take that off at the same time I remove the drains. Then I want no dressings, no compression, nothing for a week. I want you to sleep like this with your neck extended so that tissue can re-drape and tighten up. I need you to take it easy because I don't want any bleeding or hematomas. So take your blood pressure medicine, take it easy, try to relax. Do your best to keep your head and neck above your heart to minimize venous pressure. And that's pretty much it. Take your medicines as prescribed, try and relax and take it easy, keep your head above your heart, and sleep with your neck extended. Once we're about a week out, I'm gonna remove the sutures under your chin. The sutures behind your ear will dissolve on their own, and I leave the staples in the hairline back here for about 10 days, sometimes 14 days. I know that sounds barbaric that a plastic surgeon is leaving staples in your head here for 2 weeks, but the purpose of that is that's what helps keep your neck tight. Meaning I want really, really good fixation back there, holding your neck skin back and tight during the early healing phase while the skin is sticking back down to the underlying muscles. So it's super important. The other thing is I don't care if you have staple marks in your hair. You'd rather have a tight neck with some hidden staple marks in your hair than you would a loose neck without staple marks in your hair. So that's sort of how I, balance one factor over another. So the staples back here in your hair will take out up to 10 to 14 days. The reason I use staples in your hair is because they are more gentle to your hair follicles. If I use sutures back there, the likelihood or the risk that you develop bald spots where the sutures are is higher, meaning sutures create more alopecia or balding than do staples. So staples are better in hair-bearing scalp, and that's why back here I will put staples in that area, which we will remove after 10 to 14 days. If they're driving you crazy, I can remove them before that. Most people are not bothered by them whatsoever. And again, I want to try and leave them in for 10 to 14 days because it helps your neck stay tighter longer. Another couple points I want to make is avoid any and all nicotine use and avoid being around people who smoke because that can decrease blood flow to the healing skin and cause necrosis and wound healing problems. I also want you to avoid icing it. Don't ice it. Ice can also decrease blood flow, which can lead to skin necrosis and wound healing problems. Finally, avoid any and all pressure on that area until I put you in a compression garment if needed after 1 week. After a full or extended neck lift, you can shower and wash your hair after 48 hours. You can go swimming and dunk your head underwater after 3 weeks, assuming everything looks good. You can exercise after 1 week. If everything's looking good and we're not having any issues, I have no problem with you exercising after 1 week. As far as driving goes, I'm okay with you driving once you are off all pain medications during the day and you feel like you can quickly react and turn your head. Some people are hesitant to turn their head following a neck lift, and if you're gonna hesitate to check your blind spot when you're driving, you should probably wait longer before you start driving again. To learn more, check out our website where you can upload your photos and concerns as a virtual consult. You can also check out our price estimator to get pricing information for all the various procedures we offer. And finally, if you'd like to have your questions answered on a future podcast or Q&A video session like this, please leave a message on our SpeakPipe. You can go to our blog page and our SpeakPipe is located there. Thanks for listening.